Welcome back. Let's get you the latest on monkeypox. First, monkeypox deaths have been reported outside of Africa, in Spain and in Brazil. Spain is one of the world's worst hit countries due to monkeypox, where one fatality has been reported, while no details have been revealed about that patient who has died in Spain. Who died had a weak immune system. He was a 41-year-old male, the country's health ministry has said. Now, India is preparing for monkeypox, with the center even one case as an outbreak. A task force will also be set up to provide guidance to the government on monkeypox. So the first monkeypox deaths being reported outside of Africa. How concerned should India be, and what precautions should you take? And if you come in contact with a suspected case, what should you do? And when should you get yourself tested? Let's ask all these questions to our experts. Joining us this afternoon is Dr. Rahul Pandit, Director of Critical Care at Fortis Hospitals in Mumbai. Also joining us, Dr. Rajeev Jayadevan, Vice Chairman of Research Cell at IMA in Kerala. Thank you very much, doctors, for speaking with us. Dr. Pandit, to you first. Spain and Brazil reporting deaths due to monkeypox, the first fatalities in the current outbreak outside of Africa. Are these like rare one-off cases, or should we be concerned?
Good afternoon. I don't think we should be, alarmed and concerned about it. Of course, the medical fraternity wants to save life. Don't get me wrong, please. Every life is precious and we should save them. But to sort of put up a panic button and say that we've got two mortalities and start, worrying about it is not what we would actually want it to be now. We want to study what were the patients, what were their backgrounds. As you rightly said, that they may have a weak immune system. So every viral infection, every bacterial infection which can affect a patient who has got a weak immune system carries a higher risk in that particular individual to cause complications, including mortality, as compared to a normal population. So I think it's better to actually have the details of the case and let the medical experts from Brazil, where the mortality has happened, tell us what was actually the background of the patient and should there be any cause of concern at all. I don't think we should be having any reason to panic right now. And the precautions which the government of India,
yes,
as well as all the doctors have been taking, is what we should be following
up. Dr. Jayadevan, 3 cases in Kerala. The state health minister has said that there is nothing to panic there. But tell us about the diagnosis of this disease. What's the protocol Kerala is following once the case is detected? Is there like a contact tracing and testing like in COVID?
Yes, as you know, these are skin lesions primarily, and also in the mucous membranes, in the private parts as well. So if these lesions appear, they contain a lot of viruses. So samples from these lesions are sent to reference labs to do a PCR test to detect the monkeypox virus, and that's how it's done. And the healthcare community has been made aware of the protocols, how to recognize these lesions. Remember, skin lesions are so common in everyday practice, so doctors need to pick the right lesions. For example, hand, foot, and mouth disease, chickenpox, all of these are so common, and it's important to differentiate one from the other,
yes,
and then pick the right patient and send the samples to the reference lab. So India has at least 5 reference labs that are processing monkeypox-related samples. So India is well set in terms of picking up and diagnosing these cases. But your question about contact tracing, yes, each individual who has come into physical contact with this person must be watched for at least 21 days, because that's the longest incubation period. We are, in one sense, we are fortunate to have a
yes,
disease that has a long incubation period. So we got time to observe, and also when vaccines arrive, for people who have been exposed at high risk levels, yes, they can be vaccinated after exposure up to 14 days, which will give the vaccine some time to work. Remember, in a very short incubation period, the vaccine, yes, does not stand a chance against a virus. But this virus takes about 21 days to actually cause disease, so the vaccine can actually outrun the virus. So yes, that is one of the good aspects of this particular disease.
All right, Dr. Pandit, BMC's Kasturba Hospital has begun the testing for monkeypox virus there. They have got testing kits from NIV in Pune. So the city is preparing for monkeypox. When does one suspect that he or she has monkeypox, and then what should one do?
As pointed out by my esteemed panelist, Dr. Jaydev, that the symptoms could actually mimic with a couple of other common diseases which we already have in our community. For example, chickenpox. So somebody who has got fever and who develops these rashes with fluid-filled vesicles which come across more in the private parts, around the body as well, in the mucosa as well, those should definitely seek the help of a medical practitioner who are now being sensitized in city of Mumbai as well as across the country to identify these patients and get them tested in the appropriate reference lab. So Mumbai has definitely now started preparing up for any eventuality. Do we find a case which is positive in Mumbai? And that's the right way to do. What we need to do is we need to actually be prepared and be completely aware of the situation, sensitize our doctors, sensitize our healthcare mechanism, machinery, have some isolation beds ready for them, which is what has been done in Kasturba Hospital, which is our infectious disease hospital in Mumbai. And we should then identify these cases as early as possible, do the contact tracing, isolate those people who have come in contact with them because the fluid vesicles do have a high viral load. And as again, Dr. Jayadevan has said, 21 days is the incubation period.
Doctor,
so we need to actually
very quickly, what if someone comes in contact with a positive case? What should you do if you come in contact with a positive case? Should you wait or should you get yourself tested?
Is that for me or Dr. Jaydev?
Dr. Pandit, to you, quickly.
Okay. No, I don't think you need to rush and get tested yourself. I think you go and isolate yourself. Follow the government of India's protocol as well as the local municipal corporation protocol, and then they will test you according to, because as I said, the incubation period can be long. You may not test initially positive. I think you need to basically wait for whether you are developing symptoms or not before you start testing yourself.
All right, Dr. Jayadevan, one final question to you. I'm running short on time. On vaccines, you spoke about vaccines. Now some are saying that smallpox vaccine works to guard against monkeypox. Is that true? And now government has called for expression of interest for monkeypox vaccine. So should people be thinking of getting themselves a vaccine now?
This vaccine is not for everyone. It is meant only for those who have either being exposed or are at high risk for being exposed. For example, either somebody who belongs to these networks where this disease is actively spreading, or a healthcare worker who runs a sexual health clinic, who could periodically or frequently get exposed to patients who are suspected to have monkeypox. Remember, these skin lesions are extremely infectious. So people who touch these skin lesions, patients themselves could potentially pass these on to other people. So anyone who comes into contact with these skin lesions is at risk for the disease, and then the vaccine is expected to, it may not stop the disease altogether, but it is expected to reduce the intensity of the symptoms. So it is not a 100% foolproof vaccine, and it also has its share of side effects as well. About 1 to 2% have cardiac problems as well. So it is not for everybody. There is no need to panic. It is only spreading in a special network, and the general public, there is no need to be alarmed.
All right, Dr. Jayadevan and Dr. Pandit, that's the time we have. Thanks very much for speaking to us and sharing your perspective on this and those valuable inputs. Thanks very much indeed.